Thank you for tuning in. My name is Miriam Mendoza, and here I have titled America is Failing Its Black Mothers. So the problem statement here is Black mothers have the highest mortality rate in the United States. In 2021, the maternal mortality rate among non-Hispanic Black women was about 69.9 deaths per 100,000 live births, which was about 3% higher than the rate observed among non-Hispanic white women. So most pregnancy-related deaths are preventable, but are caused by social determinants and structural racism. And some of the causes of death include hemorrhaging, hypertensive disorders, infections, and cardiovascular conditions. And some of these social and racial issues that play a factor in here is social economic status, discrimination, racial biases within the healthcare system. The function of the healthcare system plays a negative role in the mortality rate. Often hospitals are short-staffed, overworked, and that increases the risk of mistakes and patients being overlooked. And many times in these communities where there are social economic issues, many of these families rely on Medicaid for their health insurance plans. And oftentimes there may be limited provider options for these patients. And the outcome of that are mothers not getting enough time and attention during their pregnancy and after their pregnancy. To address this issue, I present here 3 community-based interventions. I have first here a community collaboration for the exploration of local factors affecting Black mothers' experience with perinatal care. And the main focus here was to identify and tackle barriers to access quality care for these mothers. The second is community-based model to improve mental health outcomes and promote health and health equity. And that focuses alternative options for prenatal care, labor, and delivery. So that includes midwives, doulas, community health workers, of that sort. And the last option here is maternal mortality and disparate racial outcomes, recommendations to the government to reduce maternal mortality and racial disparities. So this is to have equitable Medicaid reimbursements for midwife services, which that would allow many of these Medicaid members to receive alternative care, but to ensure that the reimbursement is sufficient. For each intervention, I have here a list of possible partnership or collaborative that will ensure the success of each intervention. So for the first one, I have here a community organization, healthcare providers, and government agencies. So together they will, be a forefront to ensure that patients are knowledgeable and aware of what health services are provided in their area. So, and also how to access them. An example of this collaborative effort may be community organizations, gathering members of the community or local women who are expecting and, bring them in to community centers or their offices and, explain to them what providers or clinics are in their area, and if they take their insurance, participate it somewhat, or what their options are. And also those community organizations have that partnership with the healthcare providers to have that warm handoff. And also to inform these women of what government programs are available to them, and also advocate for them to apply and, seek those benefits. And for the second intervention, which was the alternative healthcare services and labor and delivery, the partners would be the Midwifery Association and nonprofit organizations that focus on maternal health. So a way they could intertwine is the organizations that are focused on maternal health to, be boots on the ground and gather women in the community and have educational sessions to explain to them what midwifery is, doulas are, and any other alternative health services that are available to them. And it's also explained to them, the risks and the benefits of it. There's many people that only think that the hospital is their only option, but there's so many other forms they could deliver their baby. And lastly here, for the Medicaid reimbursement for midwife services, we have here a partnership between midwifery associations, legislatives, representatives, and policymakers, and of course, healthcare advocacy groups. And these groups can be members of different organizations. They could even be patients who have had these services before. So it can be a collective of people, and all of these groups working together to present this to policymakers to get those reimbursements and make it easier for people in these low income communities to seek other alternatives, have different options, so they can have a more successful pregnancy and delivery. To ensure the success of each intervention, data and measurements must be collected to visually see the progression or, unfortunately, programs not working. So we first have here the measurements for the first intervention is a number of perinatal visits, and that can be collected through medical records. Another one would be the level of awareness and acknowledgement, which can be collected through pre and post intervention surveys to see what they knew before and what they knew after the sessions and, the intervention. And here, monitoring key factor rates following the intervention, which includes birth weight, maternal and infant mortality, and preterm birth. So that can be collected with vital statistics, birth certifications, and hospital discharge data. For the second intervention, a number of measurements must be collected, including number of CHWs, which are community health workers that are available, as well as doulas, midwives, and also birthing centers that are available. This is very vital for this intervention to ensure that there is sufficient support for these women to seek these alternative cares. And a way to collect it is medical records and reports from these agencies and community-based organizations that have these community health workers. And for the last intervention, we have here a number of participants who want to receive midwife services, the number of midwives available, number of appointments each participant attended, and the number of Medicaid approved appointments. And this could also be collected through records from Medicaid, which is through the state, and medical records as well. Here we have just a brief possible challenges and solution for each intervention. For the first one, the lack of awareness and understanding of available resources and support networks. This could easily be resolved by just having extensive outreach and ensuring people are informed through workshops, sessions, one-on-one, so people know the resources out there. And for the second intervention, limited availability of health professionals in underserved areas. A solution would be to train community health workers or peer support specialists to provide support and referrals. The more people that are trained and informed, the more people they can help. And lastly, the lack of insurance coverage or limited access to affordable health care services. So this would be the most difficult barrier, just due to health insurance policies, which at times takes years to change. But with time, a solution would be to advocate for policy changes to ensure equitable Medicaid reimbursements for these midwife services. And here I included the logic model with all three interventions. As we see here, they are intertwining elements within these interventions, and that's just due to like the complex issue and the different ways I wouldn't say it would be resolved, but different ways together it can be resolved. And the outcome is to decrease the Black maternal mortality, but there are many ways to aid in that fight with insurance, healthcare access, community support, provider support, volunteers, coordinator, and the list goes on and on. But altogether, as a collective community, it can happen. And thank you for tuning in. Hope you enjoyed.